this information that we get even correct information, or is this information altered?
There has been, times where, they just shut the internet off for the entire country.
People are affected, hospitals are shut down and all of that. What are your experiences in that area?
Whoever was running those hospitals just left the country, and we're talking about people who are well established, and there isn't healthcare tool supply. Electricity has been shut in parts in Khartoum, which is the capital city, since April 2023.
Hi everyone, welcome to the first episode of 2025. And I hope that you had a lovely time with your families during the festive season. My name is Itumeleng Mpofu, and welcome to Break It Down in partnership with News Live SA. Break It Down is a platform where we get to unravel some of the most complex social, economic, and political issues, making them easy for people to understand. And in today's episode, I'm proud to announce that for the first time, I am not traveling alone. I'm with a guest all the way from Sudan. For the first time, we have a guest on this platform. In today's episode, we look at the war in Sudan. In many of my videos, I have covered the war and I've answered many of your questions. I have provided the historical context. I have also provided the present day context. If you are not aware of the situation in Sudan, I would urge you to look at my social media platforms linked below and find videos titled Sudan, so that you can get to have an understanding of how the war started and where it is today. In today's episode, I've decided to call upon a friend of mine and a colleague who's going to break it down for us. I would like to introduce Osman Aldirdiri. He's a medical doctor from Sudan. He does also advocacy work in open education, open science, with a belief that information is very critical and should be made available for free. He has a long bio that if we had to get into it, wouldn't end right now. Osman, how are you, my brother?
I'm doing well, enjoying the sunshine of Cape Town.
How are you finding your stay so far in Cape Town?
It's just a lovely city. Yeah, I'm a big fan of the city.
No, I'm really grateful that we had this conversation in the background about you possibly coming to the platform so that we can actually have a discussion about the situation in Sudan, because I've done so many videos on Break It Down where I teach people the historical context. I think in some of the statistics, over 25 million people are affected, while 14 million of them are actually children. Women are also affected. Schools are not running out. So that's the information that we get to have in media platforms. So I think for the first time, we get to have a guest and actually have a human face to the conflict and try to understand, is this information that we get even correct information, or is this information altered? But I think I'll start first by saying, what is the current situation in Sudan right now?
Oh, thank you very much, first of all, for covering, the news of Sudan. And in the past year and a half, we've had a lot going on in the country, but not that so much have been publicized to the media, and it has not been brought to the attention of the public or other citizens of other countries due to many factors. But the current situation in the country is quiet and revealed, because we've got issues of connectivity and we have issues of the situation not being of an interest to the media. So we have places without people reporting from that area, and then we have a lot of misleading news, especially if you're outside the country. The current situation is that a lot of people are being forced to flee their houses every other day, and within that sense, we have a lot of schools being interrupted, educational institutions like higher or school education being on hold for quite some time now. We're also seeing that the healthcare sector has been affected. We're also seeing people without jobs, and the situation is being deteriorated every day. We have more, news about, the army getting to control more spaces of the country, but that's quite controversial. And at the same time, for the regular citizen, this is not the case where they actually see. So we have new cities being invaded. We have new people being displaced from their own houses. So the situation is a bit unclear, especially to people from Sudan themselves. So what you have to do is that you have to call a friend, you have to call a family member just to get to understand more. And for days, they do not have communication with one another. So we have incidences where someone missing their brother for like a week or 2 weeks. Why? Because they had to be displaced to different places, and then there is no sort of connection. So the situation is quite vague. A lot of people are being displaced, and there isn't like a light at the end of the tunnel, for example.
No, thank you so much for that, because, and especially for me who has been creating content in this space, the information I rely on would mostly be newspaper article, the media and all of that. And I have said that Sudan is facing one of the worst humanitarian crises ever. And even in doing research, it's so hard to actually find information. At times, you even find information that's a bit contradictory and you're not sure about what to put to the public because you could even be promoting misinformation. But you mentioned something about that access of being able to communicate with others. Now, I like to draw parallels with the protests in Kenya, where through social media, young people garnered themselves up, took over through their phones, spreading information that this is what the government is doing and we need to fight. And they went for protest. In Mozambique at present, it's the same situation. Social media has always played that key role. So I'm interested to know about Sudan in particular. Is there prohibitions in terms of access? Like, what's the situation there?
So this goes back a bit to 2018. So in end of 2018, that was December, and then throughout 2019, we had a lot of protesting happening in the country. And in these protests, there has been a change in government. So we had a government for 30 years, a dictator governor. And in that sense, people were protesting and using social media to actually like throw attention and bring it down to people that we're going to be protesting in that area, in that space. But the issue is that the government knew that internet is a very strong tool and that it can be of a harm to them. And it could be used to protesters. So there has been, times where, they just shut the internet off for the entire country. And people are being in a blackout for 2 weeks, 3 weeks. And it happened also now. So whenever a conflict starts in an area, what they do is that they just target, infrastructure of telecommunication.
Yeah.
And in that sense, you lose internet connection and you lose phone calls as well. And for months, that has been happening in Sudan. There has been alternative options, people are trying to use Starlink and then other services, but that is also illegal to use because the two conflicted parties of Sudan, both of them are using internet to communicate. So what they're trying to do there is that they try to cut the telecommunication channels, and they think that by cutting communication channels, they would be able to control the area. They'll be able to control what's happening in that city. So leaving a lot of citizens without internet connection, without phone calls. Young people would love to share, but they're unable to.
I think that's why I'm appreciative of this conversation, because with that barrier being put in place so that people are not able to communicate, we are still able to break down those barriers and transcend so that the message can go out there. And I'm hoping that a lot more people will actually go to start researching after watching this, to try understand what exactly is happening, because information is being kept inside so that it doesn't go out, But I want to segue into health sector. People are affected, hospitals are shut down and all of that. What are your experiences in that area?
So I'm a medical doctor myself, and I've been aware that the healthcare sector in Sudan has been a bit fragile, even before the war. So it has been neglected. There isn't that much investment in health. And most of the healthcare sector, especially the specialized, operations and processes, has been privatized generally in the country. So there is a public sector in that sense, and there is a private sector. But when the war started, the private sector is a for-profit sector. So in that sense, whoever was running those hospitals just left the country. And we're talking about people who are well-established, specialists or consultants, and those people can easily get jobs somewhere else. So in that sense, we had a lot of manpower migration. And also because of the unsafe nature of the country, a lot of the people were actually forced to flee their houses, and that included, healthcare staff. So we're talking about 30% of the entire population had to move somewhere, either displaced internally or had to cross borders somewhere else. So that's like 14 million people. And those people were depending on, let's say, on jobs.
Yeah.
So if you are not able to get paid, how would you sustain your family? And if you cannot put food on the table, so what we have to do is that you'll try to find an alternative option, and then you leave. And there isn't like healthcare tool supply. Electricity has been shut in parts in Khartoum, which is the capital city, since April 2022. Sorry, April 2023, which is like a year and a half now. Yeah. More than a year and a half, basically. So there has been areas without electricity since that day. And I have personal experiences with that, because I had two uncles who passed away during this war. And both of them because they were not able to access, proper healthcare. And in that access, not only like healthcare has not been provided or healthcare services are not provided, but also being able to physically get to a hospital. Because as you know, if you're in an area where the other, let's say, army or armed force is taking control of, you have to get a permission to get to that hospital. And the kind of like the situation in the country that no one knows about is that when the armed conflict started, when people had to flee their houses, so what happened is that those armed forces were actually getting into houses. So they actually break into houses, and they've stolen, first of all, like, jewelry and money. And then afterwards, they started, like stealing furniture, electricity, like all the electricity supplies and like wires and then devices and all of that. But most importantly, they stole cars. So they were like, they take your car. So I'll break into your house and I'll put a gun to your head, and then you give me your keys. And then you'd give them your keys. So no one had a means of transportation to get to a hospital. And the majority of the citizens, especially those who are still in affected areas, were not able to get to hospital. That was the case for both of my uncles, basically. They were not able to get to a hospital. So not only the healthcare sector is affected, but also, your transportation means inability to, even if you wish to leave the city, sometimes you are unable to. So, and in that sense, a lot of diseases has been spread. So there has been an outbreak of cholera, and there has been other outbreaks as well of other diseases. So people are affected in that sense, and they're unable to get healthcare services. And as a result of that, we have so many reports of people losing their lives.
As I'm listening to you as you speak, it sounds like you are literally narrating something from a movie. It doesn't feel like in the modern day, we have people that are subjected to such. I understand that you also have meetings that you need to rush to, but I'm really hoping that depending on the reception also of this episode, that we can come back and actually get into detail with the nitty-gritties, because this is not something we can capture in just few minutes that we have. This is something that needs an elaborate sit down and have a conversation and drill down into some of the things, so that whether people like it or not, we keep hammering the message into their heads. And hopefully that one or two people, even if it means just taking a placard and going into the streets and protesting, so that they bring awareness to this issue. Because whenever these type of conflicts happen anywhere else in the world, there is urgency, But when it's conflicts that affect people of color, it's like the lives of people of color don't matter, So they just left to be there on their own. There's no intervention whatsoever. And at present, there's all these foreign countries, entities that are now being involved, supplying different sides and all of that. But I think we'll get into that in much more detail a bit later on. But as we head towards concluding this episode, I'm interested to know, what are some of the key takeaways that you think as people or just in the world are some of the key lessons, takeaways from this war in Sudan?
That's a big question. Because so that war brought the attention of the Sudanese population to a lot of different, areas, because the nature of this war is very complex. It had an educational part, an awareness part. Also, it had a lot of parts where people could have taken actions in areas that they have not taken actions into, which is, so for the past, let's say 30 years, there has been a government. And that government just made sure to embed in everyone's mind that you should not be involved in politics. And when a revolution happened in 2019, the change of the government happened. We ended up with a population with people with very little awareness of what should the political situation look like. And in that sense, we had a very fragile government. And the population were not supportive to that government. So we had so many cracks that led to this war. The other part, which is there has been some sort of, let's say, segregation. There has been part of race-related racism, let's say. We can call it classism in some cases. So all of that has been practiced for years. And that had a layer also to what is happening now with the war in Sudan. And the last thing, which would be centralization. So we needed to decentralize most of the services in the country, because when the war started, it started at the capital city, but then it took only a few days to paralyze the entire country because everything was centralized in the capital. We had passports printed only in the capital city. We had most of the ministries, mainly functioning within the cities. So in that sense, we also need to decentralize our services. We need to think strategically. And Sudanese people need to get more aware about what is the nature of the conflict in their country is, what should be an urgency plan if they wish to have some, and also invest in education. Invest in education, make the new generation aware and make them involved in politics, get them involved in economy, and make sure that you actually get the population to a place where they can contribute and actively contribute in changing their future.
No, thank you for that. I'm going to ask you a question that, I would have been asking a government official of some sort, but
I'm just a doctor.
But I think it's more about, because I've been asked this question many times in interviews that I've done also for people who wanted clarity on my videos, that what do you think are the prospects for peace? Do you think there's a pathway that could potentially lead to peace? Because this is a war between two rival former friends who are fighting for control. Sudanese people have nothing to do with this war.
Indeed.
Just two sides of people who used to be friends fighting for their masculine ego who just wants to take over. So do you think there's any prospects? Or do you think there's something that could potentially, because some have spoken about possibly the eastern side of Sudan and the northern side separating, and maybe that could lead to peace. What do you think could potentially lead to peace?
I think open dialogue and understanding the nature of the war, and Sudanese people have to come together as one. So they need to put their differences aside and then think about the future. So unless we get that dialogue and we get that mindset, the conflict would still be going. Because there has been conflicts in Darfur for years, for decades, basically. And before that, there has been the conflicts in the south, which led to the separation of North and South Sudan. So not to see such conflicts happening in the future, Sudanese people have to unite as one. And that also comes through education, awareness, and active participation. So unless we get that mindset, I don't think that we would ever get to a point where there is peace, for for lifetime.
Yeah. No, thank you for that. In closing, is there perhaps something that you feel should be out there in public about the situation, or do you have any closing remarks for us?
I think raising awareness, because the situation in Sudan now is being, overlooked, and it is not publicized well enough in the media. A lot of people are unaware of what is the situation in Sudan, or they've heard about it like a year and a half ago. So just raise awareness in your own small, space, in your venue. And for the Sudanese people out there, just make sure that you educate people about what is happening in Sudan. And if you have any means of support, then please do that. And that support could be like a post on social media. You can be like reaching out to your friends in Sudan, maybe like have an interview just like this, so the voice of Sudanese people can be heard.
Thank you so much, Osman. And I have to say that I really like when I see professionals from different industries that are still socially aware and politically aware, because we tend to have a problem of just being fixated in our careers and just say, I'm a medical doctor, I'm just going to focus on that. And from ever since I got to know you, I was so confused, like, what exactly does this person do? You are in open education, you are in advocacy, you sit on all these boards, you do this and that and that and that. And I was trying to find a link, but at the end, the link is just care for humanity. Yeah. So I think you should continue in that work. And I'm hoping that we meet again when you are back in South Africa and we can actually sit properly and have a conversation. Hopefully we can even do it in such a way that if there's someone who could assist with facilities where we could even have a live audience, have these conversations. If we could have even few more people have these conversations, because this platform is to tell the stories of Africa in particular. We are not limited to what is happening in South Africa. Yeah. We want to know what is happening in Africa, what is happening in the world, and how best can we come together and unite as African people. So, my brother, thank you so much.
Thank you very much for having me.
Thank you. I appreciate it. To everyone who's been catching this episode on News Live channel or even on Break It Down, thank you so much for tuning in. Thank you so much for supporting the platform. Many videos are posted on my social media platforms. If you're interested, check out for these videos. And done. Thank you.
You're welcome.